From Psychology Today, Narcissistic Personality Disorder. The hallmarks of a narcissistic personality disorder, NPD, are grandiosity, a lack of empathy for other people, and a need for admiration. People with this condition are frequently described as arrogant, self-centered, manipulative, and demanding. They may also have a grandiose fantasies and may be convinced that they deserve special treatment. These characteristics typically begin in early adulthood and must be consistently evident in multiple contexts, such as at work and in relationships. People with NPD often try to associate with other people they believe are unique or gifted in some way, which can enhance their own self-esteem. They tend to seek excessive admiration and attention and have difficulty tolerating criticism or defeat. Although NPD is a difficult disorder to treat, therapy can help those with the condition develop their sense of self and their relationships. NPD refers to a diagnosable mental disorder, while the term narcissism is a trait that ranges in degree from person to person. Contents, symptoms, causes, treatment. Symptoms. Individuals with narcissistic personality disorder, according to the DSM-5, exhibit 5 or more of the following, which are presented by early adulthood and across contexts: a gradual sense of self-importance, a preoccupation with fantasies of unlimited success, power, brilliance, beauty, or ideal love, belief that one is special and can only be understood by or associated with special people or institutes, a need of excessive admiration, a sense of entitlement to special treatment, exploitation of others, a lack of empathy, envy of others, or the belief that one is the object of envy, arrogant, haughty behavior or attitudes. Individuals with NPD can easily strung by criticism or defeat and may react with disdain or anger, but social withdrawal or the false appearance of humility may also follow, according to DSM-5. A sense of entitlement, disregard for other people, and other aspects of NPD can damage relationships. While a person with NPD may be a high achiever, the personality disorder can also have a negative impact on performance due to, for instance, one's sensibility to criticism. Researchers have reported associations between NPD and high rates of substance abuse, mood, and anxiety disorders. These may contribute to characteristics such as impulsivity and increased experience of shame in people with NPD. The presence of narcissistic traits in adolescence does not necessarily imply that a person will have NPD as an adult. What are the different types of narcissism? There are two types of narcissism: grandiose or overt, and vulnerable or covert. Grandiose narcissism is marked by extroversion, self-confidence, attention seeking, or an aggression. Vulnerable narcissism is characterized by introversion, high sensitivity, negative emotions, and a need for constant recognition and reassurance. A unifying theme of all forms of narcissistic personality disorders is self-enhancement, the belief that one's thoughts and actions set them apart from others. At what point does narcissism become a disorder? The term narcissist has become culturally entrenched, and the label is sometimes overused. The trait occurs on a spectrum, and it's healthy for people to have a small dose of narcissism. It provides confidence to forge relationships, explore life, and take risks. Narcissism only becomes a disorder when it impairs a person's daily life through their relationships, sense of self, occupation, or legal standing. Causes of narcissistic personality disorder are not yet well understood, but biological and environmental factors both play a role. In addition to genetic roots of the disorder, research suggests that early experiences such as parenting styles and social and cultural environments also influence the course of the disorder. For example, narcissism is higher among individualistic cultures than collective ones, and competitive environments like New York more than non-competitive environments like Ohio. In terms of parenting, focus intensely on competition and success can breed narcissism, while warmth, affection, and expecting children to simply try their best can foster healthy development. How common is narcissistic personality disorder? The prevalence of narcissistic personality disorder is estimated to be between 1 and 5%. Research suggests the disorder manifests more frequently among men and among younger people. Has narcissism increased over time? There is debate as whether narcissism as a trait or disorder has increased over time. Some research suggests that the disorder has remained stable while the trait has risen, but cross-generational comparisons may not be reliable. Technology, society and social norms have all changed. On an individual level, research shows that people are generally more narcissistic when they're younger, in adolescence and young adulthood, and they become less narcissistic as they get older. When does narcissism develop? Some research suggests that narcissism traits begin to merge around the age 8, as children are developing their sense of self. However, the identity may still be forming, and displaying signs of narcissism in adolescence doesn't necessarily signal the development of a personality disorder according to the DSM-5 treatment. The treatment for narcissistic personality disorder can be challenging because people with this condition have a great idea of grandiosity and defensiveness, which makes it difficult for them to acknowledge problems and vulnerabilities. Even though change is difficult, it's not impossible. A key is to find a therapist who is trained to work with patients who have narcissistic personality disorder. Therapy can help people with narcissistic personality disorder learn to relate to themselves and others in a more compassionate way. By exploring their experience, developing their therapeutic relationships, and continue focusing patients on relationships, community and connection, narcissists can develop a healthier sense of self and with it healthy relationships with others. How does therapy treat narcissistic personality disorder? Successful therapy for narcissistic personality disorder includes a series of steps, including helping patients to find relief from immediate distress, recognize unhealthy coping mechanisms, develop new coping skills, unpack childhood experiences, learn to empathize with themselves, and eventually lead to empathize with others and live authentically.